Two giants in healthcare, one pressing question: which one truly takes care of you? On one side, the integrated care powerhouse, Kaiser Permanente. On the other, the accessible, community-focused Molina healthcare. Let's look beyond the marketing and focus on what really matters. Each area gets rated, and in the end, you'll know exactly who comes out ahead. The winner might actually surprise you. Here's the game plan. We're comparing these two across 5 big categories: cost and value, provider choice, member experience, quality ratings, and coverage area. So if you've ever wondered which is truly a better fit for you, just keep watching. Alright, let's kick things off with cost and value. So for Kaiser, you'll find some competitive copies in a few areas, and honestly their out-of-pocket costs are pretty predictable. Love that. But their premiums are usually higher, especially compared to most Medicaid options. Oh, and get ready to stay in the Kaiser world because you've gotta use their doctors and facilities. Now, with Molina, this is where things get a little spicy, way more budget-friendly plans, especially if you're looking at Medicaid or Medicare. There's a bigger range of affordable choices, which is honestly a huge plus, but watch out. The copays and deductibles jump around a lot, and if you wander out of network, your wallet could feel it. Honestly, Molina takes this one for cost and value. Next up, provider choice, because let's admit it, nobody wants their doctor picked for them. So Kaiser is all about that integrated vibe: your doctors, your care team, it's all in-house. Super coordinated, but yeah, you're 100% limited to Kaiser's own providers. Can be a deal-breaker, honestly, if your favorite doctor isn't on their roster. Now, Molina's flipping the script here. You get access to a much bigger network, you can see local docs, specialists. Honestly, the flexibility is just better. Only thing is, quality seriously depends on where you live. Big city, you're probably golden. Small town might be spotty. Still though, Molina wins just for that provider freedom. Alright, let's chat about member experience. Honestly, this is where Kaiser really shines. Their app, top tier, you can do telehealth, schedule visits, refill prescriptions all in one place. Their clinics are built to be super straightforward too, so you're not running around to 5 different places. The only knock: all these cool features don't really matter if you're not in one of their regions, since they're not everywhere. Molina's not bad here, they've got solid multilingual support and some useful mobile features. But it's just not as slick or unified as Kaiser's setup, and the experience can feel pretty different depending on where you live. Kaiser takes the crown on member experience. Quick break: did you know Kaiser Permanente was actually started as a health plan for shipyard workers in the 1940s? How wild is that? On to quality ratings. Now, Kaiser is kind of a legend here. Seriously, their Medicare and Medicaid star ratings plus the NCQA reviews are consistently top of the line. People always mention how strong their preventive care is too. The only bummer: you have to actually live where they offer coverage to get those benefits. Molina, they meet the national benchmarks, which is decent, but ratings dip pretty noticeably in some states, plus they've had the occasional run-in with regulators. Gotta give this round to Kaiser, quality's just a notch above. Let's wrap up the categories with coverage area. Kaiser, well, they're kinda like that exclusive club. If you're in California, Washington, Colorado, or a few other spots, you're set. Just 8 states and DC, pretty limited, honestly. Molina, on the other hand, is everywhere, well, almost 19 plus states, a big national Medicaid and Medicare presence. Maybe not as many doctors out in the boonies, but yeah, if you want coverage across the map, Molina's your go-to. Molina wins here, easily. Here's a visual of how both stack up in each category. You'll notice Kaiser's got that high bar in quality and member experience, but Molina really pulls ahead on cost, provider choice, and just being more accessible pretty much anywhere. So my take: Kaiser is kind of the gold standard if you want your care to be coordinated, super high quality, and in one place, but you gotta actually live in their footprint. Molina works better if you value flexibility, lower prices, and want to see any doctor from a wider network, almost anywhere in the country. Was this breakdown helpful? If so, don't forget to follow for more straight talk health plan comparisons. You deserve clear answers, and I've got you covered next time too.